So hello, today we are going to explain about how to use the Fugl-Meyer assessment for the upper limb and how to specifically use this assessment. Alright, this patient is the affected side on the left side of the body, and the unaffected side is the right side of the body. So we proceed with the first item, which is the reflex activity. So Shifa, I am going to do something with your right and left arm, which we call the flexor reflex and extensor reflex. Okay, so this is the biceps reflex. Okay, good. The tricep reflex, you need to support the patient's hand like this and elicit the tricep reflex. Okay, good. Okay, after you have done the procedure with the unaffected side, you have to proceed with the affected side with the same procedure. Okay, this is the bicep reflex. Okay, good. So next, tricep reflex. Okay, good. So that's the first item of Fugl-Meyer assessment. Next, we proceed with the second item, which is the volitional movement within synergies. Okay, it has two procedures. The first one is the flexor synergy, and the second one is the extensor synergy. Okay, Shifa. First, I need you to use your right hand, touch your left knee, and move it to your right ear, just like this. Okay, good. So next, do the same thing with your left hand, touch your right knee and move it to your left ear. Okay, good. So that's the flexor synergy. Next, the extensor synergy. Okay, Shifa, I want you to use your right hand, touch your right ear and move it to your left knee, just like this. Alright, good. Do the same thing with your left hand, touch your left ear and move it to your right knee. It's okay. Right. So that's the second item. We move on to the third item, which is the volitional movement mixing synergies. It has three procedures. The first one, hand to lumbar spine. Shifa, I need you to touch your back just like this with your right hand. Alright, good. Next, move on. Do the same thing with your left hand. Okay. So the second procedure is the shoulder flexion, 0 to 90 degree. Shifa, first start with your right hand and move it just like this and put it back. Good. Do the same thing with your left hand. Alright, it's okay. So that's the second procedure of the third item. Next, the third procedure of the third item is pronation supination. Okay, Shifa, put your hand like this and do it like this. Good. Now do the same thing with your left hand. It's okay. So move on to the fourth items is the volitional movement with little or no synergy. Okay, the first procedure is the shoulder abduction, 0 to 90 degree. Shifa, first move your right hand like this and put it back. Okay, next, do the same thing with your left hand. Okay, good. For the second procedure of the fourth item is the shoulder flexion, 90 to 180 degree. Shifa, move your hand from here to here. Okay, good. Now do the same thing with your left hand. Okay, it's alright. Okay, the third procedure is the pronation supination. Alright, Shifa, first with your right hand, put it like this and move it like this. Alright, good. Do the same thing with your left hand. Alright, it's okay. So that's the fourth items. Next, the fifth items, the normal reflex activity. For the fifth item, you want to do this item only if your patient can achieve the full mark in the fourth items, meaning that if your patient cannot get 6 out of 6 marks in the fourth item, do not proceed with the fifth item. You have to skip the fifth item and proceed with the sixth item. Anyway, I am going to show you how to conduct the fifth item, normal reflex activity. It has 3 procedures, the biceps, the triceps, and the finger flexors. And as always, you have to start with the unaffected side first, and then proceed with the affected side. Alright. So I am going to do the same thing as before, which is I want to elicit your bicep, triceps, and finger flexor reflex. Okay. First, we'll do it with your right hand. So this is the elbow reflex. Alright. This is the tricep reflex. Okay, good. And this is the finger flexor reflex. Good. Next, move on to the left side. The bicep reflex. Okay. The tricep reflex. Alright. And the finger flexor reflex. Alright. So that's the fifth item. Okay, now we move on to the wrist of the Fugl-Meyer assessment for upper extremity. For wrist, we have 5 procedures. So the first procedure is the stability at 15-degree dorsiflexion. Okay, Shifa, I need you first use your right hand, put it like this, and move your wrist just like this. Okay, good. Put it like this. Okay. If your patient can achieve this movement, you need to apply resistance to the back of the hand, and you need to ask your patient to maintain and hold his or her movement. Okay, so now I will give resistance and you have to maintain. Don't let me move you. Okay. Slight resistance. Alright, good. And okay, put it back. Do the same thing with your left hand. Okay, that's good. Alright. So the second procedure is the repeated dorsiflexion slash volar flexion. Put your hand like this and move your wrist just like this. Okay, good. Put it back and do the same thing with your left hand. It's alright. Okay. We proceed with the third procedure of the wrist, which is the stability at 15-degree dorsiflexion. Okay, Shifa. Place your right hand like this, just like this, and move your wrist just like this. Okay. So the same as before, if your patient can achieve this movement, you need to apply resistance to the back of the hand, and you need to ask your patient to hold this movement. Okay. To hold this position. Okay. Apply slight resistance. Alright. So next, do the same with your left hand. Okay, it's okay, it's good. So the fourth procedure of the wrist is the repeated dorsiflexion and volar flexion. Okay, Shifa, place your hand just like this and move your wrist just like this. Good. Okay, now do the same thing with your left hand. Alright. So this is the fifth procedure for wrist, which is the circumduction. Okay, Shifa, first with your right hand, put it like this and move your wrist just like this. Okay, good. Alright, so now do the same thing with your left hand. It's all right. Okay.
Hi Yasmin. Okay, so today I'll be doing a few assessments to test your upper extremities. So we'll start with hand. Okay, so for the hand assessment, you may provide the patient a table, but if the table is not readily accessible, you can instruct the patient to keep her hand at a 90-degree flexion at the elbow. Okay. So for this test, you perform the test on the unaffected side first, and then you move on to the affected side. Test 3 times on the affected side and score the best score. Okay, so can you make a fist with your right hand? Okay, good. Okay, now your left hand. Okay, good. Okay, so next is mass extension. So can you stretch your fingers for your right hand? Okay. Okay, so now your left hand.
Yeah.
Okay, thank you. It can be noted if the patient is unable to reach the initial movement, let's say for max extension, we can attain this movement by passively moving the patient's hand to the initial movement. So next is hook grasp. Okay, I need you to curl your fingers like this. Okay, we can start with your unaffected hand. Okay, so can you place it here?
Yeah.
So I'm gonna tug you a little bit, and I need you to resist my tug. Okay.
Alright.
Okay, good. Okay, so your left hand. Okay, good. Thank you. Okay, next is thumb adduction. So this is a piece of paper. I need you to put it between your thumb and resist my tug. So we can start with your right hand.
Alright.
Okay, good. Okay, so now your left hand. Okay, good. Thank you. Okay, next we have the pincer grasp. So I'm going to need you to hold this pencil between your index finger and your thumb. Okay, so when I pull upwards, I need you to resist my tug. Okay? Okay. Okay, thank you. Okay, now for your left hand. Okay, thank you. So now we have the cylinder grasp. So I'm going to need you to do the same thing, but this time with a cylindrical shaped bottle. So can you hold that for me?
Yeah.
Okay, resist my tug. Okay, good, thank you. Now with your... Okay, thank you. Okay, now for the spherical grasp, it's the same thing, but now we use a ball. So I'm going to need your right hand. Okay, resist my tug. Okay, thank you. Now with your affected hand. Okay, thank you. Okay, Yasmin, now I'm going to test you for coordination and speed. So I'm going to need you to move your finger from your knee to your nose as fast as possible. Okay? You can start with your unaffected hand. Okay, when I say start, you go. Start. Okay, stop. Thank you. Okay, now with your affected hand.
Alright.
Start. Okay, stop. Okay, for this assessment, you will need to observe the patient for tremor, dysmetria, and use a stopwatch to observe how long it takes for the patient to, for the subject to do 5 reps. So Yasmin, now I'm going to test you for your sensation. So I'm going to need you to put your hands on your lap like this. Okay, so this is a cotton ball. I'm going to touch you at specific places, and I need you to tell me if you feel it. Okay, so now first with your eyes open, tell me if you feel it, okay?
Yep. 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 Yep.
This is to show the patient how the touch may feel like. Okay, so next. Okay, now I need you to close your eyes, and I'm going to test you on your unaffected hand, and then next your affected hand. Okay, tell me when you feel the touch. Close your eyes.
Yep. 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 Yep.
If the patient feels both feels the touch on both hands, you may repeat the test by asking the patient if this touch feels the same as this touch. So for example, I may go like this. Does this touch feel the same as this touch?
No.
No. How does it feel like?
It feels less on
This side?
Yeah.
Okay, good. Also, if the patient is giving inconsistent responses, you can ask the patient to show where that she is being touched. For example, okay, can you show me where you're being touched?
Yeah.
Okay, what about here?
Here.
Okay, thank you. So for this next test, I'm going to demonstrate how we will perform the position or proprioception on the patient. Okay, so first, we have 4 locations in which we will perform the proprioception. First is the shoulder, elbow, wrist, and thumb. Okay, so first we'll start with the shoulder. So, I'm going to need you to open your eyes. I'm going to show you how your body part will move, and I'll demonstrate to you how it will look like. Okay? So first, for shoulder, we will need to support the patient at the medial and lateral epicondyle of the humerus, and also the distal, ulna, and radius. Okay, so this is your shoulder flexion. Okay, so this is up, and this is down.
Okay.
Okay, so now I'm going to have you to close your eyes, and I'm going to lift your arm up and down, and you need to tell me whether it's up or down. Okay, so I'm going to start with your unaffected hand.
Okay. Up. Down. Up. Down.
Okay, so you will need to do this 4 times, more if needed, to get the best score for the patient. So for that, you will repeat for the shoulder flexion on the affected side. So next, we move on to elbow flexion and extension. So for this test, you support the patient at the medial and lateral epicondyle of the humerus again, and also the distal and distal ulnar radius. Okay. So for flexion, I need you to look at your elbow, and I'm going to lift it up and down. Okay, so this is up, and this is down. Okay, so close your eyes.
Up. Down. Down. Up.
Okay. So you would repeat that with the affected side as well. So next, we have wrist flexion and extension. So for this, you will support the patient at the distal radius and ulna and the head of the 2nd and 5th metacarpals. So, okay, so I'm going to flex your wrist. So this is down, and this is up.
Okay.
This is down and up. Okay, close your eyes.
Okay. Up. Down. Up. Down.
Okay. Okay, so for the thumb, you will need to support the patient at the thumb proximal to the IP joint and the distal thumb. So here. So I'm going to move it up and down. I'm going to tell you, this is down, and this is up.
Okay.
This is down,
Okay.
this is up.
All right.
Okay, so close your eyes.
Down. Up. Down. Up.
Okay.
Okay, so now we're going to do the Fugl-Meyer lower limb assessment. So what we're going to start with is the reflex activity. And what we're going to look at is the patella and Achilles extensor reflex. So I'm just going to have you relax your leg. I'm just going to start with the unaffected side first. Okay, and then the second. All right, cool. Next is the Achilles tendon reflex. What we want to do is we want to dorsiflex the foot and, oh dear, tap the back. So what we want to see is the plantar flexion of the foot. Next one, the affected side. All right. So now, in the supine position, I'm going to ask the patient to lift their foot, lift their knee to their chest, and point their toes upwards. So I'm going to ask you to start with your right leg. Okay, can you lift your foot to your knees? All right, and point this upwards. All right, good job. Put it back down, and try with your left leg. All right, Okay, good. All right, so for this, for the extensor component, this is what a normal movement would look like. So pushing down and kicking backwards. All right. So with the second component, what we want is to bend the patient's leg at the hips, 90 degrees. I'm going to bend your legs. Can you relax? And then at the knees and the ankle. So what we want to do is we want to ask them to push down and kick backwards. Okay, so can you do that for me? Push down and kick backwards? Yep. All right, good. So remember, with all the components, always start with the unaffected leg first before you move on to the affected leg. So what I'm going to have you do is inch a little bit forward. So your legs are, okay, just that one. And what I want you to do is I want you to move your leg backwards. Yep, all right. Then can you do that with your other leg? All right, okay, good. So for the ankle component, what we want them to do is to have both feet flat on the ground. So they have to be seated. And they also have to have their heel flat on the ground when they lift up their toes. So can you lift up your toes to the sky for me, but keep your heel on the ground? Start with your right leg. All right, good. And can you do it with your left leg? Okay, good. All right, so for the fourth component, what we want them to do is to be standing. And we want them to start with their knees slightly bent and their foot slightly back, like this. If that's okay. And we're going to ask them to kick their butt, okay? So can I ask you to raise your leg all the way to your back with your right leg? All right. Can you do it with your left leg? Okay, good. Okay, and for the ankle, it's the same movement as before, except they're standing. So I want you to keep your heel on the ground and lift your foot up. All right, can you start with your right leg? All right, and your left? Okay. Good. Coordination component, what we want them to do is we're going to ask them to, with your heel, touch your ankle and move all the way up to your knees 5 times. So I'm going to explain first. So ankle to knee to ankle is one movement. So we want you to do it 5 times. All right. So for this, what we want to look at is the speed, as well as any tremors present and dysmetria, which is incoordination between the knees to the ankle. Okay, so can you start with your right leg when I say start? Okay, ready? Okay, start. 1, 2, 3, 4, 5. Okay, good. And then we'll just have them repeat with their affected leg. Okay, so for the light touch component, what we want to do is to have this area of skin exposed to be assessed. However, since this is just a demonstration, we're just going to do it without exposing the skin. So what we'll start with is we're going to touch the area with a cotton pad and ask the patient, do you feel anything? So do you feel anything?
Yes.
All right. What about here?
Yes.
Okay. So first, we show them what it would feel like with your eyes open. And then we're going to ask them to, can you close your eyes? And I'm going to do the same thing, and you'll tell me if you feel anything. Okay, so.
Yes.
Okay.
Yes. 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 Yes.
All right. So the main components that we're looking at is the legs as well as the soles of the foot. And what you want to do is you want to do it 4 times at least, more if you need to. So if the patient can feel both touches, what you want to do is you want to ask them if the touch on the right or on the left feels the same as the touch on the left or on the right. So for example, does this touch feel the same as this touch?
No, it doesn't feel same.
Okay. If you're unsure if the patient is accurately feeling the sensation, what you can do is you can ask them to point to where they're feeling. So can you point to me where you felt that?
Yeah.
Okay, good. So for the proprioception segment, what we're going to do is I'm going to have you relax your leg. I'm going to lift your leg. And we're going to move their leg around in up or down. We're going to demonstrate it to them. And they're going to have to tell us, with their eyes closed, whether it's up or down. So we start with the hip, support at the knee and the ankle. Okay, so I'm going to have you have your eyes open first. Okay, look at your leg. And, okay, I'm going to do, this is up, all right, and this is down. Okay, I'm going to have you close your eyes. and you're going to tell me whether it's up or down, okay? Okay.
Up.
Mm-hmm.
Down.
Mm-hmm.
Down. Up.
All right, good. Next, we're going to do with the knees. So I'm going to have you look at your knee, okay, and this is up, and this is down. All right, I'm going to have you close your eyes, and you'll tell me whether it's up or down.
Up.
Okay.
Up. Down.
Okay, good. Okay, so with the ankle, you have to support proximal to the ankle joint and at the foot. Okay, can you look at your ankle? This is up, and this will be down. All right, okay, I'm going to have you close your eyes. And,
Down.
okay.
Up.
All right.
Down.
Okay, good. Okay, so finally, with the big toe, this is up. Okay, sorry. This is up, and this is down.
Okay.
All right, okay, close your eyes. And,
Up.
all right.
Down. Down.
Mm-hmm. All right, good. So for the passive joint motion and the joint pain, you can continuously assess throughout the whole assessment while doing the other component. You can note whether the range of motion is similar between the both legs, or if it's markedly decreased, or if there's only a little amount of degrees in difference. So I'm just going to show you an example on the foot, which is supination. So we will passively move the patient's foot for them and also pronate. Okay? And you will repeat it on the affected side, and you'll see if there's any marked difference between the range of motions.